guys, welcome back to another week of Oddtastic, your comedian's guide to autism. I'm one of your hosts. My name is Kirk Smith, and I'm here in the apartment studio with my buddy
Graham K. That joke doesn't work anymore because it's been 2.5 years. I have not lived in a studio apartment.
More than that.
Yeah.
It's been more than that, right?
No.
Oh, you're thinking of the studio you lived in here. I was thinking L.A. I'm like, you've been back from L.A. for 5-6 years. But I guess one of those was a studio. I installed a barn door for you, and you immediately left.
That wasn't L.A. That was here.
Yeah, here I'm saying. That was a studio. That's the studio we're talking about, right?
No, it was in Bed-Stuy. I lived in a studio.
Oh, yes.
Yeah.
Man, we are way off topic
And
immediately.
then you lived in a studio in L.A. I lived in a one-bedroom apartment with like an adult.
Yeah, I lived in multiple studios in L.A.
Yeah, I didn't have a kid.
I
had a one-bedroom apartment.
Graham's always been very successful.
Yeah, you had a daughter in a closet.
It's not true.
Yeah.
It's not true that, it is true that he's been very, he's lapped me.
Well, these are the sacrifices that you make when you have a child. You move to a better school district.
That's what I was trying to do.
For your daughter.
I'm trying to do that Beverly Hills School District.
Yeah.
It was a long time ago. But yeah, I forgot about that.
Yeah. I remember that.
This is your comedian's guide to autism. We're completely off topic, but we both have loved ones with autism, and we discuss how that affects us, what's going on in the news, and
a lot of your money was spent going to visit JJ in Sweden.
Yep.
You could have used on rent.
I'm doing
Sacrifices dads make. You know, now.
Yeah, that's my vacation. You're going to Argentina. I'm going to visit my son for a week to take care of a disabled man.
Well,
I live a very glamorous life.
He's in a facility in Sweden, and there's a long wait list in America. That's why we have to do that, you know, which is a little precursor to our article, which is going to come later. How's JJ doing, by the way?
Pretty good. We have an ongoing, long-time listeners know we have an ongoing call that he missed today, or I didn't get the call. Some days he's not feeling good, or he's having a hard day, and they don't call. And but we had a call yesterday. I was in, where was I? Somewhere at some airport somewhere, and we had a nice little call. I was in a lounge in Tampa Airport, and I think he's doing good. You know, I got the okay. Sometimes fathers, because we have a hard time expressing ourselves. Not as bad as your dad, but, you know, verbally, we buy gifts. And so I always come, when I see him, I'm loaded down with at least a suitcase full of gifts. Just stuff I think you'll like, some toys.
Well, you both have trouble communicating.
You're not wrong. Mm-hmm. We're from a different time where I shouldn't have to say I love you.
I mean,
I'm
JJ,
providing for you.
JJ and you.
Oh, okay.
Yeah.
I thought you meant me and your dad.
You are a boomer.
An old school dad.
In your brain. But you are Gen X.
But I got the approval finally to get him some more clothes, because they were like, please don't bring any more clothes. There's too many clothes. Because I was bringing him, you know, I'd go down to, what's that Japanese store? It's like Uniqlo, yeah. And I have a lot of like cartoonish stuff. I'm like, I think I like this. I think I like this. Mm-hmm. And so I go through the sales racks of whatever's on sale and get him a bunch of oversized. He had like 5 years ago, he had one that said Fortnite that his people that work with him thought was hilarious. They thought that was great. So he wears a lot of Fortnite T-shirts. He doesn't play Fortnite, but I thought it was cute. And I want him to look like he's, you know, one of my things is I want him to kind of fit in and not feel like he's, you know, when we go out, I want him to feel like he's okay. So my son's nonverbal, so I don't know what he's thinking, but I definitely don't want him to feel like, you know, we grew up very poor. And, you know, it's an old joke, but we had the like Adidas with 2 Ds kind of things and things like that. So I don't want him to feel...
4 lines.
Yes. I don't want him to feel like he's out of the loop and he's...
I had those.
Yeah. So we had I don't think I had until I was late high school, I got my first pair of Nikes, I think. We had a bunch of... I can't remember the brands. It was like, I don't know if the brands are even around anymore. But I don't want him to feel... I don't want that to be an additional area where he feels a little bit...
LA Gear. Sears.
Pony. You remember Pony?
Oh, yeah, Pony. Remember, but Sears had shoes.
We had...
my friend had a pair of some made-up brand, and they looked like Nike Air Maxes with the air bubbles in the heel,
Yep.
but it was just solid plastic. we called them air plastics.
That's terrific.
Yeah.
That's terrific.
Yeah, just a hard surface to jump down
It
on.
lasts forever.
Oh yeah. But it was like a regular sole, the foam, and then a see-through area that was a solid brick of plastic.
Oh boy.
Yeah.
It might work. You know,
Yeah.
It might be. I don't know. So I'm starting to. I go see him. What day is today? Today is the 13th. So I go see him in about 10 days. Is that right? A little longer, about 2 weeks. So I'm starting to. They gave me the approval. Like, okay, you can buy him some more T-shirts. His weights fluctuate, so now he's on the big end of the weight. He's about 260. So that means double X T-shirts, and so we're back to double X. We're back up in
Oh, really?
the doubles and triples.
How do we
yeah.
feel about that? You worried?
I don't love it. I'm going to ask him about Ozepam. What's that called?
Ozempic?
Ozempic. All our friends in LA are taking to lose weight, I assume.
Yeah.
And I mean, because he's getting close. He's getting close to that edge where where you're concerned. It's not for looks. I'm not trying to get him to get a 6-pack. I just want his weight to get down to not be on the obese side for health reasons. And putting together his little trip. December 2nd is his birthday, and so I'll be out there for that. It'll be fun. How about Peter? How's good old Pete doing? Peter Parker, Spider-Man.
He's good. I just bought him a listener just sent me a link to a web shooter.
Ooh.
That goes on your wrist. It has a little Spider-Man glove, and then it has like a web shooter on the wrist, and you press it, and it shoots out a suction cup attached to a string. And it costs $30, and I'm sure it's going to break immediately, and it's going to be a waste of time, and it's probably the cheapest hunk of junk. But when he opens it up, I'm sure he'll be really pumped. So I had to do it. $30. It's worth it. He's doing well, He's been calling a lot lately, so I feel like he's lonely. But his spirits are high. I haven't been picking up a lot, Usually I pick up every day. It's been every second day. And today, after we got off the phone, he's like, "Hey, do you want me to call tomorrow?" Because I didn't pick up today. I told him to call at 11, and then I still didn't wake up. I'm feeling weird today. And then he's like, "You want me to call tomorrow?" I'm like, "Yeah, call whenever you want." And he goes, "How about I give you a break, and I'll call in 2 days."
Wow.
Yeah. We'll take today off. Graham, we'll do a break. And
What do you think that's about?
I think he's just getting he kind of feels, maybe he feels like
Self-aware?
maybe a little self-aware. Maybe. Which I think is a growth and nice
For sure.
in a way. But I feel a little guilty, but no, whatever. I'm excited to see him. I'm going to see him in a couple months, Christmas. He's helping out my parents a lot. There's no real big update. He sent me November 1st every year. He sends me the Christmas presents on email of what he wants.
List. Christmas present list.
Christmas present list. He does not send me presents.
Yeah.
Yeah. He buys me a T-shirt every year, usually a Spider-Man one or
a medium.
Well, now he does XL, but Spider-Man or anyway, or Star Wars. And sometimes I'll cut off the sleeves and wear them to the gym, and then people will be like, "You're a big Spider-Man fan, huh?" I'm like, "Nah, not really." But lately, the past few years, like I get them twice a year, one for my birthday, one for Christmas. I have like a footrest for my couch. It's a leather poof, they call it, and you need to fill it with stuff. So it's just filled with like 10 years of T-shirts. Of Spider-Man and Star Wars T-shirts.
Some other labels on still.
Yeah, I don't have to buy stuffing for it. So, yeah.
We should set up a Christmas thing for underserved kids with autism who love Spider-Man. You could regift. You could regift. Somebody would love those. I
know, but now that I need it for my footrest.
Sure.
Yeah. But he's doing fine. He's doing fine. My parents are doing fine. It was my mother's 75th birthday today, and they had birthday dinner last night. My brother came over, and Yeah. He reminded me that it was my mom's birthday coming up a week ago, which was nice, even though it's in my calendar.
He's like your own little Facebook calendar.
He is. He is.
Now, does he have Facebook?
He
No, right?
doesn't go on it anymore.
Okay.
He used to.
Okay.
He used to go on there a little bit, but now Now he just goes on YouTube and he goes on and he watches like Disney Plus. So, yeah,
That's great.
he's a busy little guy in his own little way, I guess. He told me again today that my friends are not my friends anymore; they're his
They
friends.
stole him.
Yep, and he's right. He's right. But should we do in the news?
Let's do it, man. Am I reading this one? Grandma found this one.
Mm-hmm.
Newsmedical.net. New report underscores the weight crisis for children seeking autism diagnosis and evaluation. Cognoa, a leading child development and behavioral health company, today published a new report, The State of Pediatric Autism Diagnosis and in the U.S., gridlock, inequities, and missed opportunities persist, end quote. That underscores a long-standing waitlist crisis for children and their families seeking a diagnosis of developmental delays and autism evaluations. The report assesses the results from 111 specialty centers, across the U.S. On average, children and their families are forced to wait 3 years from the time of the first concern of developmental delays to an autism assessment. Delays in diagnosis mean that children are missing the opportunity for early intervention during the critical early neurodevelopmental period when interventions have the greatest life-changing impact. Excessively long waitlists to see the small number of available specialists and absences of a standard of care are a major cause for concern throughout the healthcare community. The study, which has been conducted by Scott Badesch, 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 former president of the Autism Society of America, sponsored by Cognoa, uncovers widespread reimbursement issues that prevent families, especially the already disadvantaged, from receiving an evaluation and subsequent early interventions altogether. Key findings reveal that the inequities and inefficiencies in status quo processes that are leaving most children and families behind. Unacceptably long wait times for evaluations. Nearly 2/3 of specialty care centers surveyed report wait times of over 4 months between an initial request for an autism evaluation to a time when a diagnosis evaluation is conducted. Of that group, 21% report waitlists of more than a year, or that are so impacted that they are no longer accepting new referrals. Reimbursement barriers reinforce health quality inequality. 44% of centers surveyed do not accept Medicaid, pointing to an access and disparities that affect an already underserved communities most. Only 65% of practices accept communal insurance, forcing those who cannot pay initial costs up front to forego care. 77% of clinics identified the extreme lengths of assessments, processes, and heavy documentation burdens among the top barriers to a timely evaluation. 69% of clinics identify staffing issues, including clinicians and administrator shortages. 43 cite burdensome reimbursement processes and inadequate or lack of reimbursement as a barrier to timely care. Here we go. Last section before Grandma falls asleep over here, Mommy.
No, I'm in.
No
'Cause I know you're going to ask me what I think.
No standard of care. The data shows high variability in the assessment tools used in the diagnosis process, which there are over 30 listed. There are vast state-to-state, and healthcare payer-to-payer differences in requirements of both assessment and provider types for an autism diagnosis to be recognized for reimbursement. 83% of centers report that evaluations of autism take over 3 hours. Of these, 25 report evaluation completion times of over 8 hours. Research shows that these lengthy assessments are not necessary for most children. Equipped with a diagnostic made for their settings, primary care clinicians and pediatricians can accurately and rapidly evaluate and diagnose and manage most children with developmental delays and autism, all within the medical home, says Dr. Sharif Taraman, CEO of Cognia. Yet in most cases, the forces that make the autism specialist the only option. Sorry. Yet in most cases, the forces that make that's what it says. In most cases, the forces that make the quote autism specialist end quote the only option for a diagnosis. I think it's missing a word there. Anyway, this is an imbalance any healthcare leaders and policymakers must take seriously when directing future resources and developing initiatives to standardize, equitize, and streamline evaluation processes for families, irrespective of insurance types. We're all failing our children as a nation, and it's vital that we expand and empower the tools providers can use to evaluate diagnosed children and need to start with the primary care. Oh boy, last section. Advocates would do well to support policies that would encourage providers to get out of their own way, said one of the specialists surveyed. We need to prioritize the needs of the local populations by adopting innovative solutions that include comprehensive integration of APPs, advanced practice providers, and general pediatricians with additional training and other mental health care workers, especially when these services are provided with a patient's medical home in an integrated model, especially when the services are provided within a patient's medical home in an integrated model. To be clear, this can be done from a cost-effective manner that is good for morale, improves providers' personal satisfaction, especially if the work is done in a way that clearly advances the goals related to diversity and equality. Graham, what do you think?
I think it's absolutely criminal that it would matter what kind of insurance you have, whether or not your child who needs help gets help or not. I mean, seems completely morally wrong, and I do not understand it. I think we can all agree that, I mean, you know firsthand that there is just not enough services. And it is a growing problem, and it's a ticking time bomb, and we are failing our children. We really are. And I don't know. Yeah, it just seems like obviously there's a funding issue, but there's also just a policy issue, just like in terms of what that the fact that it's state by state also bothers me. Shouldn't there just be one, like it should be one national? It's a human right.
Makes sense to me. It should be national.
It's a human right. It is a human right.
I just feel like we're at a point in the country where this isn't a new epidemic, autism. I mean, we've talked about this.
You haven't talked about the reason why JJ is in Sweden specifically in a long time in terms of, well, we know that your Lorena was half Swedish, had Swedish citizenship, so he gets right to Swedish facilities by way of that. But why is he not
a shortage of housing
in America?
In America.
Why is he not in America?
There's a real shortage of housing in America if you have a young person, let me start over. If you have a child with autism who's young, this probably isn't on their radar yet. Let's say your child's 8, but there's a real drop off of services. A few years after high school, whether it's 21 or 22 or 19, depends on the state. They're all a little bit different, but at some point, they're no longer in the school system. For JJ, we stretched it out a little bit to 21, but and then there's a real dearth of housing where even if the housing is in theory approved to be funded as a disabled person, there aren't enough places available. I was in
and programs to help training for jobs.
And that's
another. So they're not just housed.
They're two completely different things, and they're both there's a shortage of both.
Yeah.
I was in California 3 weeks ago, and I did a benefit for a friend of mine who he has a severely disabled son, even more severe than JJ, and he's opening a home in Kingsburg, California, out kind of in the middle of the country where land is cheap, and it's a beautiful facility. But if he doesn't open that, there's nothing available for his son, so he felt the need. And he by the way, he's a 75-year-old man, my friend. So, and he's retired and he's really sharp. But most people, that's not on their radar, where they can just not work and just dedicate full time to I'll just open an autism home in the middle of the desert. So
it's private. It's private.
Yeah, it's private, but it's private because there is a lack of, and there's a severe need.
So people pay him rent?
No, the way he does it is he fundraises He fundraises the difference. But again, it's a small facility. You've got.
It's just inefficient individually fundraising stuff.
I mean, I don't know if it's inefficient. I think it's
for his specific scenario, it's efficient because that's all that's available to him. But nationally, on a national scale,
it should be funded
if you have a
nationally,
bunch of private places that are individually trying to get GoFundMe's going and going to the laundromat and asking for donations, it's inefficient. Whereas you could have a national.
Well, I just think it
would be cheaper for American people, for citizens in the long run.
Yeah.
How many of these people are homeless? How many of these people end up criminals? Or how many people end up in you guys know. You don't need me to go on this weird rant, but
I wouldn't use the word inefficient. I would say it should be more of a priority as a nation to fund for our down and out, our disabled, the Bible talks about the least of these, the people that need the help. So to me, it should be a national priority, and it's not. And we've talked about this before, but you pay for it one way or another. You pay for it if the people are homeless and out in the street. You're also paying for it. There's a price to pay as a society that you live in the kind of place that there's a homeless man, bumping into you and who doesn't understand, who's on the train and there's a human poop in the street or whatever. So you pay for this stuff one way or another. So I think it makes sense to fund these programs. Yeah.
Anyway, did we do it?
We did it. I do want to announce, guys, I get emails from time to time. People that have asked me, if you're looking for a guest, I could, people that want to be guests, people that have books coming out, and for a while we haven't been doing it. But I think we're going to try to open it up. It's just been a issue of time and trying to organize it, and I just didn't feel like it was something I could handle. But right now, we're going to try it. My email is kirksmithcomedy@gmail.com. If you want to, if you know someone that'd be a guest, if you have a subject that'd be involved, if you think you'd be a good interview candidate that you would like to,
you have a good story,
you have a good story. Yeah,
we could share.
Yeah,
maybe other parents need to know or could help, or siblings.
Email me. No guarantees. Depends on how many I'll get through, how many of these I can get through, and I've got a few other things going on. I'm on the road 25 days a month, but we are going to try to do a couple of these and see how it goes and see if it's something that we could do on an ongoing basis. Again, kirksmithcomedy@gmail.com. Unrelated to that, you would do me a big favor if I'm trying to get my Facebook fan page, which is Kirk Smith Comedy, to a point where I can use it to have people come to shows off that. So you do me a huge favor. If you would click follow on that, it doesn't cost you anything, obviously. All my videos are on there. You can see, you can share them, but Kirk Smith Comedy, and also my YouTube is Kirk Smith Comedy. If you could hit that subscribe button, that would really help me. And if you're under 30 and you just use Instagram, then Kirk Smith Comedy on Instagram.
They're on TikTok.
I'm on TikTok, Kirk Smith Comedy too.
Under 30 is TikTok.
Sorry,
just so you know.
Under 35?
30 to 40 is Instagram.
Got it. Grandma, what are your social medias?
Graham K. Comedy on YouTube. I'd love it if you gave me a follow as well. And also, I've Mr. Graham K. on Instagram and OK Graham K. on TikTok. And yeah, that's
my YouTube. I'm at 998, and I need 2 more follows to get to 1,000. At 1,000 for YouTube, it's where you can monetize, and at 10,000 for Facebook's where you monetize. I'm trying to get those little numbers above that. If you could take a second, I'd really appreciate it. That's it, guys. Have a great week. You can do it.
Bye-bye.